top 5 causes of death in the Philippines according to the PSA includes heart attack, stroke, cancer, diabetes, and hypertension. These diseases are together known as NCDs, or as non-communicable diseases. NCDs are medical condition of long duration, or otherwise known as chronic diseases. They are the result of a combination of genetic, physiological, environmental, and behavioral factors. According to the Philippine Academy of Family Medicine, major NCDs like cancer, cardiovascular diseases, diabetes, and chronic respiratory diseases represent 70% of the annual causes of Philippine mortality, or about 600,000 deaths nationwide. The World Health Organization states, the economic cost of non-communicable diseases to the Philippine economy is about 756.5 billion per year. This amount represents direct costs associated with the treatment, care, and social security provisions, and indirect costs from the loss of workforce and reduced productivity. NCDs can be prevented by minimizing the risk factors involved. Behavioral risks include unhealthy diet, physical inactivity, tobacco use, and harmful alcohol use. Intermediate risk factors include overweight or obesity, raised blood sugar, high blood pressure, and abnormal lipids. These risk factors, when present, progress later to heart disease, diabetes, stroke, cancer, and chronic respiratory diseases. Investing in programs and policies on preventing NCDs is highly cost-effective. A peso investment can expect a return between 7 and 30 pesos. The Philippine government is committed to tackle NCDs and had passed multiple strategies, plans and legislations to control tobacco, alcohol, unhealthy diets and physical inactivity. But despite the policies and programs, the lack of preventive health delivery to the grassroots remain inadequate.
With the recent State of the Nation address, delivered by President Ferdinand Bongbong Marcos Jr., the President expressed his vision to bring healthcare closer to the people.
Bukod dito, upang mailapit natin ang healthcare system sa taong bayan, nang hindi sila kailangang pumunta sa sentro ng kanilang bayan, lalawigan o region, ay maglalagay tayo ng mga clinic, mga RHU, na pupuntahan ng mga doktor, nurse, midwife, medtech, 1 beses, 2 beses sa isang linggo. Nang sa ganon, magiging mas madali sa may karamdaman na magpapagamot ng hindi na kailangan magbiyahe ng malayo.
During the post-SONA briefing, the Department of Health officer in charge, Maria Rosario Vergeri, said, "Dynamic provision of healthcare services must gear toward technology and innovations, and not just rely on the usual approaches to prepare us for future emergencies or pandemic. We are going to establish our telemedicine services so that we can continuously decongest our facilities and to reach those far-flung areas in the country," Vergeri said. But telemedicine services can be limiting at times, as it is merely an audio and video communication between a doctor and a patient. A doctor can hardly assess your heart or lung sounds during a telemedicine call. Telemedicine too lack other important physiologic parameters like blood pressure, temperature, oxygen saturation, ECG, spirometry, and a whole lot more. Introducing Remedy Plus. Remedy Plus is a revolutionary, comprehensive telemedicine software and hardware that collects patient physiologic parameters, like heart and lung sound, through a digital auscultation device. The device records, stores, and transmits sounds over the internet for the doctor to hear it in real time. Remedy Plus can monitor blood pressure, heart rate, respiration, temperature, and oxygen saturation parameters that automatically reads out at a touch of a button. Remedy Plus conducts special physiologic tests as well, to include ECG, spirometry, Doppler ultrasound, and dermatoscopy. These tests can be done prior or during a teleconsultation call, as if the doctor is sitting right in front of you. Remedy Plus offers diagnostic laboratory tests too. Tests include hemoglobin, lipid profile, glucose, urine tests, and communicable disease tests like hepatitis, HIV, malaria, syphilis, and dengue. A recent added feature to the Remedy Plus kit is the troponin test, which can detect heart attack immediately and accurately. Other tests not specified can be added into the software system upon request. Furthermore, Remedy Plus provides administrative users with extensive metrics of the top illnesses diagnosed, or the frequent medicines prescribed, or other data-driven analytics your organization may require.
Remedy Plus Solutions Kit is a software and hardware device that allows you to conduct telemedicine consultations. It has an electronic medical record that allows you to store patients' medical and laboratory tests, provides electronic prescriptions to patients, generates printable and downloadable patient medical records, and even houses a medicine inventory system for organizations that provide medicine directly to their patients. Remedy Plus Solutions Kit incorporates devices used for screening NCDs, which include blood pressure to monitor and detect hypertension, ECG to evaluate heart diseases, body mass index calculator to measure the individual's body fat, blood glucose to monitor and detect diabetes, lipid profile test to measure cholesterol and triglycerides in your blood, troponin to detect the presence of a heart attack, spirometry to measure problems in breathing and respiration, and digital stethoscope to hear heart and lung sounds over the internet. Other devices the kit provides include fetal Doppler to check the baby's heart sounds, dermatoscope to detect and diagnose skin lesions, communicable diseases confirmatory test kits for hepatitis, syphilis, dengue, and others, urine test, temperature detector, and oxygen saturation. Optional tests that can be included but not part of the basic kit include ophthalmoscope, otoscope, Cervere AI, the first artificial intelligence-based cervical cancer screening remote readout system that can detect precancers with up to 89% specificity and 93% sensitivity, and many others. Remedy Plus Solutions Kit is ideal to use in rural health centers and in remote areas, mobile medical buses, e-clinics, schools, and infirmaries. For more inquiries, please visit our website at www.remedyplus.com.